and welcome back to the Osteo Physio YouTube channel. Due to popular demand, we are going to be covering lateral collateral ligament injuries of the knee. The lateral collateral ligament is the outside ligament of the knee. So if we've got the kneecap here, it's the one on the outside, and it is absolutely vital for stability, so stopping that excessive shift side to side, and also reduces the amount of posterior lateral rotation. So its main aim around the knee, same with the medial collateral ligament and the cruciate ligaments around the back, is all about that knee stability. It actually is less likely to be injured than the medial collateral ligament, so therefore when it does become injured more commonly through high impact sports or trauma to the knee, it is normally not in isolation. So if we've damaged the LCL, it is incredibly common that the anterior or posterior cruciate ligaments are involved. And then if we're thinking about the rest of the anatomy around there, so we've got the popliteus muscle around the back of the knee, and we've got the outer part of the hamstring, so the bicep femoris, that can typically get involved in the injury as well. Most commonly, the type of injury that we see is a hyperextension injury, so the leg is overly straightened, and then typically with rotational or a side impact. So it's normally, if the kneecap's here, the impact's coming from the inner part of the knee to impact the LCL on the outside, and with a ligament it's normally that it's overstretched or ruptured or torn. So what we need to make sure before we do any rehab is that this knee has been imaged and it has been assessed properly, due to the fact that there are normally lots of structures involved. Once you've had it diagnosed by a specialist and you know the grading and they've given you an idea whether we need that surgical intervention or that specific rehab, that is when I would potentially move on to the rehab exercises that we're going to talk through today. Stage 1 is all about working alongside a musculoskeletal expert. So if you've got bruising or swelling post-injury, if it's a grade 1 or 2 and surgery is not needed, or you're going through that recovery post-surgical intervention, we need to get the bruising and the swelling down, and we need you to feel that confidence of loading through the knee before you go on to the rehab exercises. So rest, ice, compression, elevation, all of the stuff that people talk about all the time. So ice, elevation through the knee, and then you want to start to gently walk on it. If you can start to walk on the knee relatively comfortably and you're not feeling like it's giving way and you can weight bear through, that is when you can start to think about progressing onto these exercises. We get asked this all the time, and I always advise these to my clients: work alongside a musculoskeletal expert when you're watching and using the exercises today. So starting off, we want to aim for gentle flexion and extension of the knee. So because the knee is a hinge joint, we need to regain full range of motion, because it's very common post LCL injury to have limited range of motion where it's been so sore and swollen and guarded. So we want to aim between 5 to 10 reps. So I'm doing it laying down because it's a little bit easier, and you're sliding the foot out as far as you feel like you can go, and then gently bending it back up again. So initially the range will be significantly less, but you want to build this up over time. Again, we're repeating this whole routine 1 to 3 times a week. We're then going to do gentle flexion and extension. This is where we're engaging the quadriceps muscle around the front. So we're going to bring the leg out straight, hold for a couple of seconds, and then relaxing back. I'm doing this lying down. You might want to do this seated, where you're bringing the leg out in front, holding for a couple of seconds, and then bringing it back. Again, we're aiming between 5 to 10 reps. So yes, we want to regain stability, that is really important, but initially we want to regain that smoothness of movement and activation through certain muscles. The next exercise we're moving on to is gentle abduction into the hip joint. And the reason why is, as the LCL is healing, and particularly around the back of the hamstrings and any other structures involved, we want to fire in your gluteus medius and minimus that abduct the hip to help with that overall stability. So we've regained movement and we've started to activate the surrounding muscles through the knee, but we also need to support through the hip. The second way we're going to do this is try and fire through your gluteus maximus muscle. So I'm doing this whilst lying on my tummy. You want to aim to lift the leg up, hold on end range for a couple of seconds, and then relaxing back down. So we're aiming between 5 to 10 reps of this exercise. And again, you're thinking about the body as a whole. Yes, we want to work into the knee, but we also need the structures and the muscles around that area to add extra support. Next, we want to aim to look at activation through the hamstring belly. So with all of this movement, you will probably struggle initially to go as far as I'm going with each of the moves, but that is what you want to aim to improve. So we're looking at quality, not quantity initially. You're going to bring up the heel towards your bum, hold for a couple of seconds, just feel that firing around the back of the knee, and then relaxing, again aiming between 5 to 10 reps. So with all these exercises today, it's the beginner exercises. Later on, we're going to advance these videos, which we will add in, where we're adding in more resistance. Next and finally, we want to do a step up. This is a great way to regain stability. So we're lifting up through, holding for a second, and then relaxing. Lifting up towards, holding for a second and relaxing. So you're trying to regain that pressure and that stability through the knee very gently over time, aiming between 5 to 10 reps of that exercise, and you want to repeat this routine 1 to 3 times per week.